Welcome to the special edition of Inside the Americas, focusing on the coronavirus. Latin America has now become the epicenter of the pandemic, and Brazil is suffering from death tolls that rival the United States. Mexico is not far behind. My name is Johan Grillo, and I'm France 24's correspondent in Mexico City. Now, we're here at the airport, which is normally the busiest airport in the whole of Latin America, with 50 million passengers every year. But right now, it is virtually deserted. And this is a symbol of how the virus is really shattering an already fragile economy, which is going to have bad social impacts. Latin America is also facing this virus with health systems that are much weaker than those in Europe and the United States. And that could lead to a really bad fatality rate. It still seems to be fairly early in the curve, so we have a long and hard road ahead. Now we're going to the very south of Latin America, to Declan McGarvey in Buenos Aires, Argentina.
A strict lockdown has been in place in Argentina since the middle of March, and to an extent it has worked. Infection rates have been low. That said, those infection rates are now beginning to rise more sharply, particularly in the densely populated urban slums of Buenos Aires. This is where the coronavirus pandemic hits extreme poverty and overcrowded conditions, and the devastation of its potential impact is causing alarm for the experts. Now we go to one such place, Villa Azul, a small slum located some 30 kilometers south of the capital city, Buenos Aires, and a hotspot for infection. The government response has been dramatic. An entire neighbourhood of 3,000 inhabitants placed under isolation for the last 10 days.
Not a single soul has left the small shanty town of Villa Azul, except for the sick. Nobody has entered, save health workers and those who carry food. But the inhabitants say this is not enough. Pablo, a social worker, agrees. Each day he arrives to bring supplies. But the police make things difficult, and he has quickly moved on.
They don't let us speak with the people inside. So we try to contact them by phone, but not all of them have cell phones. The neighborhood is totally militarized. To lock them in like this is condemning them to be infected.
At another gate, less guarded, it's the same. Gabriel leaves food for his brother, locked inside.
We are scared. Everyone inside is very scared of being contaminated, especially for the children. The only thing left to do is pray.
The aim of this strict isolation is to prevent the spread of the pandemic. As just on the other side of this bridge stands another shantytown, Villa Itati, which shelters 15 times as many people as Villa Azul. Both neighborhoods are alike, and contact between their populations was fluid until very recently.
People from Villa Azul used to come here to play soccer all the time, even during the quarantine. We didn't know that they were so infected.
So the government has acted. Volunteers walk the streets to raise awareness about the quarantine and hygiene measures. But how can people wash their hands if they have no water? How to observe social distancing in overcrowded conditions? On our way, we pass a busted water pipe.
It's been weeks since we were left without water. They fixed the pipe yesterday, and now, again, the water is gone.
The government's efforts are exhaustive. Going house to house, their teams check for symptoms, send people for tests, and calm their distress.
People are scared to have to leave their children in case they need to be isolated. They are scared because their houses are too precarious to respect the quarantine.
More tests carried out in these trucks reveal more cases each day. Beyond Villa Itati, there are many more similar neighborhoods close to Buenos Aires and its sprawling suburbs. Here, the pandemic has only just begun.
Now, as the Southern Hemisphere winter takes grip in Argentina, this is a nation that is fighting a battle on two fronts, the coronavirus pandemic, but also a lasting and damaging recession that is now in its third year. Now, the nation's President Alberto Fernandez has won much praise for his policies of putting health before wealth, but his government is now under increasing pressure to reactivate Argentina's economy, and particularly in the capital city, Buenos Aires, the nation's economic engine, but also its biggest hotspot for infections. Now, the big question going forward is whether the president will cave into that pressure or if his government will continue its vow to protect the lives of Argentinians at all costs. And now we go back to Mexico and Luan Grisho.
We're here in the south of Mexico City, an urban sprawl of 23 million people that became infamous for its pollution. Now, a silver lining of the coronavirus is that in many cities around the world, the lockdown has drastically reduced the traffic and the levels of pollution have plummeted. But that has not happened here in Mexico City, and we are still breathing dirty air. In the following report, we will find out why that's the case, and the air here has not become cleaner. Empty avenues, weeks going by free from the relentless noise of car engines. At the end of March, the Mexican government brought in voluntary measures of social distancing, and since then traffic in Mexico City has plummeted. But the same is not true for pollution. Although CO2 has gone down, other pollutants are causing problems, and there are still air quality alerts.
In spite of the reduction in mobility and activity, we had 8 peaks above the air quality norms because of small particles. And we also had serious concerns about the ozone level.
A main reason is that April and May have always been bad for pollution in Mexico City because of high temperatures and lack of rainfall. During the same period last year, the Mexican capital had the worst pollution in 25 years. This led to school closures and traffic restrictions.
When you look at ozone peaks from previous years, you realize that the situation was even worse. This year, we did have pollution peaks, but less than during the last decade.
The megalopolis of 23 million people is trapped in what is known as an atmospheric basin. The main winds come from the north, where there is a thermoelectric plant and refinery. This makes sulfur dioxide spill over the city, and NASA's study found it among the 5 most polluting refineries in the world. This pollution can make residents more vulnerable to infections like coronavirus, says this doctor specializing in lung disease.
Pollution-borne diseases include chronic obstructive pulmonary disorder, asthma, and lung cancer. The patient who lives with these pathologies tends to be more seriously affected by COVID and have a higher mortality rate.
Doctors say that pollution-borne diseases are a permanent sanitary crisis, killing 9,000 people each year in Mexico City. And when the lockdown does finally end, we worry the pollution here could get even worse. Now we're going to go to Rio de Janeiro, Brazil, with correspondent Lucinda Elliott.
Hello everyone, from Rio in Brazil, a country that has fast become the epicenter of the coronavirus pandemic. Here, the daily death toll regularly surpasses 1,000. But as well as the lives lost, the virus has sparked political turmoil amid a national crisis. Along the beach of Copacabana, supporters of President Jair Bolsonaro regularly gather. They are now calling for the reopening of businesses and the closure of the country's Supreme Court that is investigating its leader.
We have a big problem. The Senate, and primarily the Supreme Court in Brazil, has been appointed by previous governments. A whole band of judges chosen by the Workers' Party, and they want to remove the current president.
We want our president to be respected. We voted for our president. We never voted for Supreme Court judges.
Our Supreme Court is entering into innocent people's home, working people's home, and robbing them of their right to express themselves and to protest, tearing up the Constitution.
Political chaos at a time when infections are yet to reach their peak. More and more businesses like this are reopening, some well ahead of an official 6-phase plan to ease lockdowns. as Latin America's biggest economy gets hit hard. Restrictions, officials say, will be phased in through to August, a relief to millions. But according to the Pan American Health Organization, Brazil could surpass 88,000 deaths to the coronavirus by early August. And all this when its president is finding it increasingly difficult to govern. Handing over now to our correspondent Ed Augustin in Cuba, a country unlike Brazil that has mobilized quickly to stop its spread.
One of the reasons Ernesto Che Guevara is such an icon for the Cuban Revolution is because he was a doctor. This country has the highest doctor-to-patient ratio of any country in the world, with 1 doctor per 110 people. But they're not all working in the country. And since the pandemic started, Cuba has sent teams of doctors and nurses around the world to battle coronavirus. Cuban doctors and nurses have been sent to 23 different countries, and Cuban medical brigades have even made it to Italy.
I'm doing this because the principle of humanity was central to my training. Being a patriot and being humane is vital. We should share what we have with those who really need it. And right now, Italy and other countries need our help.
These doctors and nurses joined the 28,000 Cuban health workers that were already working in Latin America, Africa and Asia prior to COVID-19. By working abroad, these health workers earn many times their small salaries here in Cuba. And the export of professional services, medical services, is now by far the island's main source of hard currency. In these difficult times, with tourism gone, more than ever, doctors are keeping the island afloat. Here in Cuba, there have been just over 2,000 confirmed cases of coronavirus. Wearing a face mask is obligatory, but there's never been a full lockdown imposed here. One of the main principles of the Cuban healthcare system is the idea of prevention. And up and down the country, around 13,000 Cuban family doctors, supported by nurses and 28,000 medical students, are knocking on doors 7 days a week, trying to root out new cases of coronavirus as they emerge. That's it from Havana. Now let's cross to Bogotá, Colombia, with our correspondent, Simón Bruno.
Red rags like this one became a symbol of generic economic distress during the confinement in Colombia. Everything started when in the city of Soacha, in the southern outskirts of Bogotá, the mayor asked to the starving family to signal themselves with a red rag like this one. Suddenly, this became a universal symbol for SOS in the country. And this shows how precocious was the life of many of the people living here, where basically half of the population live of informal work and day by day. Colombia entered lockdown at the end of March when the virus was just stepping its foot on the continent. The economic situation is getting worse, the number of red rags is increasing, and this generated an unprecedented solidarity among Colombians. Many of them couldn't stand the idea that their neighbors were starving, and so they decided to solve the situation themselves. Let's watch this reportage filmed here in Bogotá.
Since the start of the pandemic, Ivan, the owner of a trendy restaurant in Bogotá, has visited the popular Santa Fe district 3 times a week.
We've traveled less than 2 kilometers, and it's a whole different reality. We see red rags and people calling for help.
Behind each red rag is a family in distress.
We hung it there because with this situation, we can't get work, and it's hard with children.
Ivan filled the trunk of his car with meals that he prepared after the midday restaurant service.
Here we have a meat stew with rice. We always cook a different dish, so almost every day we bring something new.
It's 4 p.m., and for many people, it's their first real meal of the day. Over a few stops, Ivan and his group of volunteers have distributed 200 plates of stew.
There is too much poverty, far too much. This is a drop in the middle of the ocean. It's a lot and it's nothing at the same time.
In this metropolis of 8 million people, citizen initiatives like this one have multiplied during the quarantine. More affluent districts have organized ways to support people in poorer surrounding neighborhoods.
People who live near La Macarena and other nearby neighbourhoods donate food all week long, and on Saturdays we call a gathering.
Claire is French and lives in Colombia. Along with a few neighbors, she organizes a weekly aid distribution to the poorest. 2 blocks away, the queue gets longer every Saturday.
Keep your distance, you're too close. And all put a mask on, please.
Despite an ambitious emergency plan unveiled by the city government, many of these people only survive thanks to the solidarity of the neighborhood.
This is for today. We'll see what tomorrow brings. Because there are 5 of us.
It's a series of local and spontaneous initiatives. I don't know if it will last after a pandemic. Ideally, this would generate more social mobilization, but for the moment, it is very local.
Whatever happens, in Bogotá, the pandemic will be remembered as a moment of mutual aid in one of the most unequal societies in the world.
We reached the end of this special program, Coronavirus in Latin America. Thank you for your attention. If you want to know more, keep watching France 24. You can also follow us on france24.com in English, French, Arabic and Spanish. Goodbye.